thanks for joining us. This is RxTI Talks, and I'm Adam Chassie. We're talking to Nick Cindric, President of PharmaSeek Financial Services. We're going to talk about the financial challenges faced by sites and what PharmaSeek Financial Services can do to alleviate those.
Well, PharmaSeek Financial Services is a wholly owned subsidiary of PharmaSeek, and what they do is they provide financial services for research sites, products ranging everything from receivables management to receivables factoring to Medicare coverage analysis. We also offer budgeting assistance and contract negotiation assistance. So I think the biggest challenge for research sites is when they perform the work, they don't create an invoice. And if you look at other industries, typically either a service is provided or a product's produced, and then the buyer of that service or product is invoiced. In research, what happens is the work is performed, the information gets entered into EDC, and then there's a validation process where the monitor comes out and verifies that the work was performed, and that then is what drives the payables process. And what we do in terms of receivables management is we track what work is performed, and we do our own calculations on what is owned, and then we reconcile that against what the manufacturer, the sponsor, pharmaceutical company, or the sponsor says is owed to the site. Most sites, when we start the service, we find that they're not doing a good job of tracking how much money is actually owed to them. Oftentimes there's reimbursements that have to be invoiced or they will not be paid, things like archiving or specific procedures. And on average, we find most sites are missing between $1,500 to $4,000 per study. Just doesn't get collected, and it almost becomes a leaky bucket for the sites in terms of revenues. I don't think it's so much, and I think a lot of sites believe that they feel like the sponsors are trying to cheat them out of the money, and the same thing when it comes to quarterly reimbursements. They feel like the sponsors are trying to do something to disadvantage the sites, and I really think it just becomes an economic situation for the sponsor where whether it be quarterly payments or whether it be the lack of payment on certain items, they establish the payment terms in the CTA, and if the site doesn't follow them, they don't pay it. And I don't think the sponsor feels a responsibility to go back and make sure that they were paid. I mean, if the sponsor asks in the CTA that they be invoiced for certain things, they expect the site's going to do it, and if the site doesn't do it, I think they feel like their responsibility really isn't to follow up with the site to make sure that they're following through on those types of things. For the most part, it's retainer may not be the best word for it, but we take 100% of their business, so we're tracking for all their sites. We do have some sites that choose to give us selective studies, so they may give us their more difficult studies or studies that have a significant amount of procedures or a significant amount of non-scheduled visits, that type of thing, where there has to be a lot of invoicing and a lot of tracking to be done. But for the most part, I would say 90% of our customers give us 100% of their business. There's, in terms of our growth opportunities, I think there's tremendous opportunities out there. Usually when we're out working with a site and we demonstrate the value of the service, we get a high acceptance rate. So a lot of times we're selling the service, we go out and we trial the service. We'll take 4 or 5 studies. We may reconcile some recently closed studies to see what wasn't collected. And then from that, we demonstrate the value to the site, and they give us more studies, and it just feeds upon itself.
RxTI Talks is brought to you by the Rx Trials Institute. Thank you for watching. Join us for more episodes, each highlighting some of clinical research's most innovative companies and individuals. Looking for more great thinking? Join the conversation at the Site Solutions Summit this October at the PGA National Resort in Palm Beach Gardens. Proudly hosted by the Rx Trials Institute, this year's summit brings together more sites, sponsors, and CROs than ever before. Visit www.sitesolutionssummit.com and register today before the seats sell out.